So I chose plastic surgery pretty early on. I knew I always wanted to do surgery. I've always loved working with my hands. My dad was a dentist, so I think I came by that naturally. But plastic surgery, it just kind of combined everything I loved about medicine, everything I loved about art. I liked the fact that it was broad as a specialty. I also liked the fact that there was a lot of finesse in it. You know, if you take out a gallbladder and you do it either 75% perfectly or 98% perfectly, you can't really tell the end result. But in plastic surgery, that difference between a 75% and a 98% really shows in your results. I like that you could see your operative results. I can see the exact effects of what I did on a patient. The most rewarding part of my job is definitely when patients get to see their own results. Watching a patient, look down at their breasts and start crying because they're so happy. There's nothing that will ever compare to that. I think my patient care philosophy just involves really listening to the patient. It's easy for plastic surgeons to have kind of their idea of what they think the patient should look like after surgery, but you want to make sure that that matches exactly what the patient wants and to take all their needs into consideration. If I weren't a plastic surgeon, I would definitely have to still do something that involved art and probably something that involved medicine. The best thing I could think of that would still combine most of those would be a facial prosthetist. So that's someone who makes facial prosthetics for patients who've been involved in an accident where they're missing a lot of tissue in their face. When I'm not at work, I like hanging out with my family. I have a husband and I have a 6-month-old daughter, so that's really fun. We also have a dog. I love doing art projects and I really enjoy rock climbing. What I hope patients gain from their interactions with me is that they really feel heard. That's a way I always try and make patients feel. I want them to feel that I'm listening to them, that I understand what they want, and after their surgery, I want them to feel confident.